In this video, we're going to explore the most frequently asked questions for Hannah Torres' massage therapy. If you have a question that doesn't get answered here, then you can reach out directly via 541-337-7851. So let's go ahead and get started. Hannah, what type of massage therapy do you provide?
I have some training in several different modalities, but my favorite modalities to work with are connective tissue massage. That's like deep tissue massage. It's good with sports injuries or motor vehicle accidents, or just to help people who work out and or have injuries from repetitive stress injuries from work. And then the second modality that I enjoy doing is manual lymphatic drainage. This is stimulating for the immune system. People need to get lymphatic drainage after they've been being treated for cancer, if they've had breast surgery related to cancer, or even just plastic surgery, then lymphatic drainage is necessary.
I've heard about the lymph system or lymphatic system before, but I'm not quite sure what it is.
The lymph system is basically the way that our immune system does its work. Everywhere that we have arteries and veins going through our body, right next to those arteries and veins are a smaller vessel that is the lymph vessels. And when the blood goes out of, when the arteries get really small, the little arterioles, and they start to be porous so that the blood can go out of the veins, out of the arteries, and it becomes interstitial fluid. And that's how those blood cells get carried to every cell in the body to nurture those cells and feed those cells. But what happens with a percentage of that interstitial fluid, it goes back into the lymph to be cleaned. So the lymph nodes, you could imagine them like a bunch of little grapes. This is where the B cells and the T cells are breaking down toxins in the body, bacteria, when you have the flu, so viruses and bacteria. Our body breaks down that stuff in the lymph nodes. And so when we do a massage, we can increase the flow of fluid through the lymph nodes and kind of give a big boost to the immune system. And what happens with when people have cancer, sometimes some of their lymph nodes get damaged. And so that system needs a little bit of help.
How exactly can Body Talk help me?
I don't make a diagnosis, and I don't treat symptoms. What Body Talk does is we find a priority of what systems in the body want to improve communication. There might be a block in communication between different systems or different aspects of the body mind, and we can remove the block, or we link up. We create a link, and that creates more balance and better communication, and that restores the balance of the body, and then the body can do its natural healing process. When we find more balance and the different parts of your systems are in better alignment and communicating with each other, then your body, when it's in a state of balance, it can heal itself naturally.
Who would give me a Body Talk session, and what is that experience like?
Well, I'm a certified Body Talk practitioner, and you come into my office where I have a massage table, and the client is fully dressed, but they lay down in a comfortable position on my massage table. And I have a protocol it's like a map on the wall. That's a map of everything that we need to address in the session. And I use biofeedback. I'm lifting your arm in a gentle motion, and I'm asking yes or no questions, and I get a muscle response that tells me yes or no. And then when we have a formula, we tap out different, we place our hand on different energy systems in the body, and we tap out to balance the formula.
Why did you begin the path of training in body talk?
There was a time in my life when I was struggling with a severe anxiety and depression, and I had a friend who was studying the body talk system, and she thought it would really help me, and I did several sessions with her, and I found it, all my friends noticed an extreme change in me, kind of like a shift, and it was so helpful reducing my anxiety at the time that I really wanted to learn the system so that I can bring that to other people.
Why is it that I would want to explore body talk over other options?
Body talk is non-invasive. It's extremely gentle and highly effective healthcare without having to have surgeries, we don't use invasive procedures or pharmaceutical drugs. However, body talk is used, it's a good modality to use in conjunction with seeing your doctor for something that you're already seeing a doctor for. Body talk is like a partner.
If you still have questions for Hannah Torres, or you want to learn more about scheduling, then reach out to her directly via 541-337-7851. Thanks so much for watching, and have a blissful day.